But so I wanted to pare it down to things that I thought might not be covered elsewhere or that were really essential features or things to know. So I'm going to start sharing a screen here. Let's see. Did I share that properly? I hope so. So, so as we're moving forward today, let's see. I thought that I would jump right into one of the questions that some families have asked me at appointments. And that is my child, because of the fact that they have a disability, at greater risk of getting COVID than other children? And I think the answer to that is sometimes. So for the diagnosis of autism or other behavioral developmental disabilities, there's no direct evidence of any increased risk for COVID, including for immune issues. So as you guys know, many kiddos with autism spectrum disorders will have autoimmunity problems, but there has been no evidence that because of any autoimmune problem, there's a greater risk to getting COVID. However, there's some unique aspects to our kids that puts them at slightly increased risk. For children who are still have care providers coming into the home, that means that they have increased exposures to different people throughout the week as compared to a child who's just home on the no school plan. Many of my patients and other kids with autism spectrum disorders will also have comorbidities, medical problems that go along with autism. For example, seizure disorders are more common in kids with autism spectrum disorders. And so sometimes kids with seizure disorders have to go into the emergency room if they have a bad seizure breakthrough, or have to go in for more routine care, like lab work for medications and things like that. So that puts children at slightly greater risk. And then the last feature that does put kids with autism at slightly greater risk is they have difficulty with some of the safety habits that we've been trying to emphasize to everyone in the public. And I know it's hard enough for me not to touch my face, and I'm telling that to a child on the autism spectrum is that much harder. Sometimes hand washing for the full 20 seconds can also be more of a difficulty. So a child with a neurodevelopmental disability is not at greater risk of getting COVID-19 alone, but some of the factors surrounding their care may influence their risk. The second question a lot of families ask me is my child, if they get COVID, are they in a higher risk group for complications? And I would emphasize that with neurodevelopmental disabilities, they're not directly in a risk group because of that. They may be at a slightly increased risk based on associated features. For example, some kids on the autism spectrum are on medications that cause difficulty with weight gain or with blood sugar regulation. And if your blood sugar is dysregulated, that can cause you to be in a higher risk group. Some kiddos have the risk of seizures, and if they're having uncontrolled seizures, that can put them in a higher risk group. Some of my patients, in addition to autism or other neurodevelopmental disabilities, will also have mobility limitations, like with cerebral palsy. And because of the effect on your lungs of mobility limitations, that can cause an increased risk. So it's not the child's neurodevelopmental diagnosis, but sometimes some of the related medical situations that they're dealing with can put them at slightly higher risk for complications if they were to get COVID. But even with kids who have many comorbidities, there are very few children who have to be hospitalized or have a negative outcome with COVID, even with those comorbidities. So please feel reassured that way. But I wanted to talk about some of the things that, with those factors that can put a child with autism at slightly higher risk for being exposed to COVID, how we can help with that. And one of the things that I'm sometimes asked about is, well, might I have home care providers, providers that come into the home to assist with my child during the day. How can I help that to be a safer protocol? What should I do? And, the first thing I would say is if you can consolidate the number of providers coming into the home, even if they're coming in on different days of the week, the actual number of individuals being reduced is helpful. So if you can work with your providers to have just 2 or just 3 instead of 5 different providers over the course of a week, that's going to help with exposure risk. I would suggest requesting that they do a temperature check when they get to the home. And I would also suggest that you request the provider to expose to you if they have had any primary or secondary COVID contacts. So if they know that they have been in the home of another client whose brother had COVID, that's a secondary contact. So they were in contact with their client, but the client's brother, the secondary contact, had COVID. And I would ask them for any, just to let you know if they've had any primary or secondary exposures. It is definitely recommended that that provider should wear a mask, a washable mask. Cloth mask is great. And that should be on throughout their entire interaction with your child. I would also ask them to remove shoes on entry into the home. There's been some suggestion of pathogen sharing on the bottom of the soles of shoes. So, if they've been in other homes with droplets on the floor, you don't want that into your home. So I would have them remove their shoes at the door. And then if there is a dedicated location that you could have them go immediately for hand sanitation and washing and have some antibacterial soap available, that would be helpful. While they're with your child, we want them to be engaged with your child as they need to be to serve their function. But if some of their function is companionship or not direct physical care, using distance during the time that they're there as is possible for that child is helpful too. Now, when you're working with your child, we do want to help them focus on learning how to not touch their face and learning how to do safe hand washing. So with the face touching, that's really tricky. And the more you think about it, the more you want to touch your face. So it's almost like the elephant in the room. Don't think about the pink elephant behind you, and that's all you can think about. So I would say, don't say no. Don't do that. Don't direct them in a negative way. Instead, keep it positive and distract them. So if you see your child doing a lot of face touching, first try to figure out why they might be doing that at the time. Is there a little bit of peanut butter left over from lunch that might be causing a tactile stimulation problem? So, clean their face or help them, assist them with that. Pull their hair back so there's not stray hair coming into their face. And if you can't find an answer, or if it's part of a self-stimulatory behavior, then the best tool that we have is to keep those hands busy with distractions. So, hey, let's come and help mom in the kitchen. We're going to come and do some Play-Doh. Why don't we use some of these fidget toys, having a basket of fidget toys that as soon as you see them touching their face, pop a fidget toy into those hands. That's the best way that we can kind of positively encourage lack of face touching. If it's a significant issue, you can place some Band-Aids on the fingertips. Often when a person touches their face with a Band-Aid on it, it doesn't feel as good, so it feels a little scratchy, and it can try to reshape that behavior. And then the other thing is, the more active a child is during the day and the more other touch they get, deep pressure, foot massages, hand massages, the less likely they're going to be doing those sensory seeking behaviors like touching their face. And I know it's been super challenging to keep everyone active during this in-home time, but I'm hopeful that as the weather turns and we have less snow, we'll be able to get out and spend some outside time each day. With hand washing, I think that it's one of those mandatory things that we have to do. And so having it integrated into a visual schedule for the child, I think is very helpful. I think you on the ASA website and on the KidsLink website, there's some examples of coronavirus schedules. So what you can do at home and how to piece your day together. And I would include in that a plan for hand washing. At the hand washing location over the sinks, I would also consider including a visual schedule of what the child needs to do, including some type of mechanism for them to know how long is appropriate for hand washing. That can be a visual timer. It can be a song that you play on a stereo each time they're or sing together each time that they're washing their hands. It can be having their iPad there and they get to watch a favorite video clip from a YouTube that's about 20 or 30 seconds. But the minute they quit washing their hands, the video clip goes off. And so, try to help them learn that to watch this video clip that you really love, you're going to have to continue hand washing. And then always working on praising them or rewarding. But this is such a mandatory type of activity that I would do hand over hand with a child or a young adult as needed. So just to make sure that they are able to clean effectively. The other thing you can do with your child is kind of help, and yourself, is to help optimize your health. And these are just things that we all know but are hard to do, like getting daily exercise. Even if it's just 20 to 30 minutes per day, I've been struck by how little I move when I'm doing telehealth from this chair all day instead of getting up and walking around and engaging with patients. And so really being mindful to integrate at least 20 to 30 minutes every day of some type of physical activity, even if that's just taking a walk or doing light cleaning. And then I think it's very important to get some sleep. And our sleep cycles can get completely out of whack when we're at home and not having as many early mornings to wake up and get ready for school and those types of things. So being mindful of sleep, of eating habits, of trying to get some fresh fruits and vegetables in there when what we really want to eat is the skinny popcorn that I keep eating. But trying to have a good amount of healthy elements to your diet as well. I think it's super important to get outside and try to get some vitamin D and in the sun that we do have here in Ohio. And if you're not able to get outside very often with your child, consider a vitamin D supplement for them during this time frame and a multivitamin. So vitamin D supplement should be about 2,000 IUs per day. That's one usually of the over-the-counter capsules. Some of the over-the-counter capsules are 1,000, so that would be 2 of those, but it's the standard dose daily. There is new evidence mounting that individuals with vitamin D deficiency actually respond poorly if they get COVID. So it's a negative risk factor if you get COVID. So we want everyone to have good, strong vitamin D levels, and none of us do in Northeast Ohio just from the sun alone because we don't have enough of it. So consider vitamin D and then a multivitamin for your child. Find a multivitamin like Centrum Junior, a 1-a-day junior, 1 a day for the teen age group, has a teen boy and a teen girl with different minerals based on their body's needs. You want something like good RDAs of calcium, magnesium, and zinc. It helps both with the immunity for your child and for you, as well as just for the nutrition. And then this is the last ones for us more than for our kids, is to remind us to skip the caffeine and the quarantinis and other alcohol, because that actually they both do decrease your level of immunity. I'm going to be talking more about mental health things that we can do later. So preparedness, what can you do? What's really the bare bones essentials of what we need to do for our family when we have a child with a neurodevelopmental disability? Medications. With medications, so far so good with availability on medications at the pharmacies, and I'm very hopeful that we are in the top of that plateau here in Ohio, and that the pharmacies won't be overwhelmed. But I would really like each of you to try to get 90-day supplies, if your insurance allows for you to do that, of all essential medications for your children. In order to get those medications, consider mail order, especially at this time, because a mail order usually will send you 90 days at a time. And consider, if you can't get 90 days or mail order, consider delivery options. I know there's many different delivery options out there. Recently, CVS has a new program where you pay $10 a month, but then if you spend $10 a month, they give it to you. So it ends up free as long as you spend $10 a month, and you get free delivery, free home delivery within 2 days. So consider those types of delivery options that might be at your pharmacy, because I think that there are a lot of programs are coming out for that. Keep an up-to-date list of dosing your child's, all their medications, including any supplements you may have them on, with the dose and the time schedule that they get the medication, as well as a list of any allergies. When I'm asking for you to do this, for keeping these types of lists, like the medication list, the list of emergency contacts, the list of doctors with their contact numbers, it's for two reasons. Reason number one, if you got sick, then another provider would be able to have that information. Reason number two is if your child gets sick, and we'll be talking about that in a minute, you will want that information to be readily available so you don't even have to think about it as you're going to seek medical care. Another bit of preparedness that I would consider is having your child have an emergency ID that includes their diagnosis, as well as any medications that they're on and drug allergies, and any extra diagnoses. So if they have asthma or seizures, as well as autism spectrum or a genetic disorder, have those on there. So, you know, you don't have to have a medic alert to have an emergency ID. And in fact, a lot of my patients won't wear medic alerts because it bothers them to have something on their neck or on their wrist. You can even just write these things down, type it into the computer, shrink it down, laminate it, or just write it out. If you don't have a laminator available right now, get like a cardboard stock piece of paper and write it on the cardboard stock piece of paper, and then put a hole into the side of it, so it's small, like the size of an address label, and then tie that onto their belt loop. Or a great place is if in their tennis shoe, at the very edge, like towards the toe, where they won't have any stimuli of that rubbing against their foot. It'll be down near their toe, and a lot of kids will tolerate that. I think emergency IDs are very helpful, again, should you or they ever have to go to an emergency room or into the hospital. I just wanted to comment briefly on important supplies. I think this probably is redundant information, you've heard it before, but in addition to that 90-day supply if possible of routine medications, I would also get any as-needed medications that your child has stocked up. I would ask that you have both child and adult Tylenol, with at least enough for 20 or 30 doses per person in the house. There is still controversy about whether or not ibuprofen impacts that cytokine cascade that can worsen COVID, but more and more research is looking that way. So we really want you to have some Tylenol instead, should a member of your family get a fever. Mucinex is very, very helpful for that inflammatory phase of COVID. So at first you get kind of like the infectious type of symptoms, like the cough and the sore throat and the runny nose and sometimes bowel issues, and then the secondary, like after a week, you get an inflammatory phase, which is where it develops into pneumonia and a lot of secretions that's causing a lot of problems from a respiratory perspective. And we don't want you to give your child or yourself Robitussin or something that's a cough suppressant. Cough suppressants, you quit clearing those secretions and it's bad. So you want instead an expectorant like Mucinex, where it helps you get it up and out of your body. A thermometer, if you can find one, they're hard to find these days. Gatorade or other electrolyte-rich drink. I would try to have at least maybe 3 Gatorades per day per person stocked, for a 4 or 5 day period, just in case your family became ill. And some cloth masks for sure. On the cloth masks, if you're like my family, I cannot sew, and I did not stockpile masks, so I have none. But online, there's some wonderful on the Ohio coronavirus.ohio.gov. They have a great video of how to make no sew cloth masks that even a sewing idiot like me, I can't do it, but I could do the no sew version with like little hair bands. They're pretty easy to make. So now what do you do if you get sick with COVID? So I mean by this, as a parent, what should you be thinking about if you were to get sick? And I would say before that ever occurs, you want to have a plan for self-isolation within your home. So if one adult in the home gets sick, if there's other adults in the home, how will they remain separate from you? Um, if there's only one adult in the home, it's very important to identify some extra caregivers that could come in the home for your child or young adult. I would say that if it's caregivers other than a parent who intimately knows your child's routine, it's important to have a clear written schedule and routine, including triggers for your child, how to know whether they're feeling happy or sad, what to do if you see a trigger, comfort items, how they communicate, all of those things kind of clearly outlined. Because if you were to get ill, we would want you to be kind of secluded from your child. You can still interact with them online and find ways to talk to them on the phone and things like that within the home, but we would want you to be completely separate. So trying to identify who would be available to help out in that situation is really important. Now, if you did have to self-isolate, what does that look like? Optimally, you want to be in a room that has the least amount of engagement or airflow with the rest of the house. So preferably like a one-door location that people aren't apt to come into or out of frequently, and somewhere, a room that's kind of in a side part or a basement part of your home that's less used would be very, very helpful. And then within that room, any items in the room need to be treated as if they were had viral particles on them. So any items in the room need to stay in the room, basically. So unless you take precautions, if at all possible, if you're ill but well enough to help with, putting any tissues into bags and tying them up and putting them to the side for removal later, that would be fantastic. If you have linens that have to be washed, if you could put them into a container for the adult who will take them out for you, that would be great. I would recommend that you have a clean and dirty laundry basket. So when the ill person puts items into the laundry basket, clean stuff can't go back into that basket. That's only the dirty basket. So it can go back into your room, but it can't go be waiting for stuff to come out of the dryer. So a separate basket. All clothing and linens have to be washed in hot water. And then your partner or provider that is coming to get your clothes or bed linens for you to change and wash them. After they do transport your items to laundry, they should do hand sanitation and should optimally shower or change clothes themselves. Always, only one person should be designated to interact with you if at all possible. So one caregiver should be interacting with you. And they should always wear a mask, as should you. So if your child gets sick with COVID, it's also important to decide on that isolation plan ahead of time. And with most of us who have children on the developmental disability spectrum, we realize that if our child with a developmental disability gets sick, we're going to too, because we aren't going to be able to self-isolate significantly from them, and that's okay. But I would say that if you have other children besides the child with a developmental disability, it's helpful to have like one, if it's a two-parent family, have one adult be designated as the caregiver for that child with a developmental disability who has COVID. And it may be easier for any other adults or caregivers and other children in the home to actually do the isolating, meaning that it might be really hard to isolate a child with autism in a room that they don't like. You might have to let them have the whole main floor of the house, but then everyone else stays in the basement or goes to a friend's house, so you might have to move the people who aren't ill rather than the child with the developmental disabilities who is ill. I would say for choosing that one caregiver, I would recommend, if you have the luxury of choosing between two adults, choose that caregiver who has the least risk factors themselves, because they are going to be exposed. So choose the person who has the least heart, lung disease, diabetes, obesity, or hypertension. Those are the biggies that lead to risk factors of more poor outcomes. If your child does get sick and you think it's COVID, go ahead and notify your pediatrician immediately and discuss a plan for what you would do if you would need to go to the hospital, but do not take them to the hospital unless pediatrician recommends it, because we're still in what's called level 2 tier testing in Ohio, which means that unless you have severe symptoms, you won't get tested when you go to the hospital. If you only have mild to moderate symptoms, they'll say, yes, you probably have COVID, and then you will go home. So it's not worth the trauma of going to the hospital for your child, and you won't come away with knowing much more than if you stay at home. So talk to the pediatrician. Hopefully more and more of us will be able to be tested soon, but right now we're still on that level 2 tier testing. For hospital trips, when you think your child needs to be seen or go ahead and call ahead of time. I think it's very important, because, and I would say if you have a neurodevelopmental disability specialist, a neurologist, developmental pediatrician, call them too, because they can help in addition to your pediatrician with paving the way for an understanding in the emergency room of your child's needs when they come in. There was this great form that Lori Kramer actually told me about, and the website is here, called a health passport, and is by the OACBDD, and it's a great health passport that includes a lot of the things like I mentioned, the list of medications, the list of doctors and contacts and providers and emergency contacts, but it also asks context of your child's needs. It asks on there, and you can fill it out ahead of time, of how you can calm them if they feel agitated, what types of things scare them, what do they like, how do they communicate. And I think it just was a nice single piece of paper that kind of pulls it all together. But if you don't have that, definitely bring that list of medications, contact lists, and don't forget a security object for your child or young adult. Definitely wear a mask when you're out and about, and have your child do too if they'll tolerate it. And then for visitation, I think it is important to know that all of the organizations in Northeast Ohio in our area, so the Cleveland Clinic Foundation, Rainbow, and Akron Children's, all have decided that if a child with developmental disabilities is admitted or comes to the emergency room for COVID, their family member, a designated family member, will be able to stay with them. You may have to sign a waiver, but that's okay. As a mom, I'm like, sure, so I'll sign anything. I'm staying with my kiddo. So that won't be an issue. I know that as COVID was starting to become a hot topic a month ago, a lot of us had concerns of children with developmental disabilities being separated from family members. And that won't happen for sure in Northeast Ohio. So another thing that I wanted to talk about, that we're blessed to have some good minds at the state level that have come up with some thoughts about treatment prioritization. And again, it looks like we may not have a shortage of ventilators here in Ohio, which is a blessing, at least for this first wave. But there was some chatter in some of the southern states about how they would prioritize people for getting those ventilators, should they go and should they not be available. And in one state, there was some question about whether or not a child's cognitive, or a person, not just childhood, a person's cognitive status, including dementia or other developmental disabilities, would be a negative factor in that decision making. And that is not the approach that will be taken in Ohio. In Ohio, should we ever reach this phase, which I hope we do not, the principals would be looking for priority at the number of life years saved. So meaning that children would get a higher priority because they have longer number of years to live, and then chance for recovery. And it's chance for recovery based on physical issues. So if an individual had a severe cardiovascular disease, that would be a point against them. If they have chronic COPD or lung disease, that would be a point against them. For children, there would be very few of those negative points for severe risk for recovery that would count against them. And so there's a mathematical formula that's been suggested for clinicians, should that ever occur, that would include those two factors in a formula. But I think the reason I'm bringing this up is just because talking with some of the staff from the Autism Society, I heard some fears about, well, will my child's cognitive ability or disability status influence the decision? And the answer is no. They would be given equal priority for medical care. So the last thing I wanted to talk about just briefly is that mental health piece for parents. And I think that the most important things that we can do for our children is try to keep our own mental health up and secure and good. And that's hard. That's hard to do at this point in time because we're all anxious and there's so much unknown. A good friend of mine, Dr. Richard Cowan, who works at Kent State, is always saying this, and the first thing I put on here, put on your oxygen mask first. And I think that there's a good reason that they say that in the airlines, and it's the same as in this situation. If you aren't in a good mental health state, neither can your child be. And so it's very, very important. I know that just keeping up with our kids can be more than a full-time job. And then you add into that telecommuting that a lot of families and parents are doing, and it's overwhelming. But it's really important to think of yourself and your needs, because your child will benefit if you do so. So I'd remind you to keep your own routine in order. I know that when I first started staying home from COVID, I tend to be a night owl, and it got worse because I took care of everyone else during the day and then wanted a couple minutes for myself, but it got a little too late. So really trying to keep and making sure that you're getting that 7 to 8 hours of sleep per day is important. Getting outside each day, get that vitamin D, get your exercise, very important. I also think it's important to have some type of retreat space in your home, and to try to find even 15 minutes that you can go to that retreat space, be it a nook off of the laundry room, or an office space, or a cozy couch in the basement, anywhere, and just kind of be alone and by yourself for a little bit of time. Now, I know that does require having a partner in the home, or having a caregiver come in, but I hope that each of us can find that time. If you're really doing it all alone, feel free to reach out to friends and families to take a break program through the ASA, or talk to reach out. We can find help for you, and I think that it's just important to have a couple minutes to yourself. The other thing you can do is lower your expectations. And I am not going to be that Pinterest mom in the middle of coronavirus, and neither should you be. So it's okay if your kids don't finish everything that they're supposed to on the packets that they've been sent home, the Blizzard bags. It's okay if they get spaghetti 3 days in a row. It's okay if you haven't, called all of your older relatives, weekly. It's okay. Give yourself a break. Another thing you can do is find something to do that you can control. There's so much that we can't control right now, that sometimes when you're feeling your anxiety rise, doing something very routine and that you can control really helps, and control the heck out of it. So like sort your closet or the pantry, go through and itemize what you've got, or sort the underwear drawer, something like that. You can control that. It's repetitive. It's mindless. It helps when you're having one of those big anxiety days. Another thing you can do with those big anxiety days is try to chunk time. So by that meaning, instead of worrying about what you're going to do tomorrow, worry about what you're going to do the next 30 minutes. And then after that, the 30 minutes after. And then after that, the hour after. And so trying to think of brief chunks of time rather than the more global picture. And then realizing that this is temporary. I think something that's helped me with anxiety about all of this is limiting news media. There's just too much statistics and controversial opinions, and I think turning it off is sometimes helpful. You know what you need to do. You have the tools to keep your family safe. Sometimes it's okay to turn that news media off. And then don't forget to try to reach out to friends or family as you can, or focus on some of the positive impacts or lessons from this experience. I think one thing that our family has taken away from this is that out of boredom, we've found things like we've done some game nights with our other family members that live around the country, and we've tried to get creative and found that Categories and Balderdash, Farkle, there's a game called Pun Intended. Those are all good, and you can play them online really easily. And so I think we'll continue that as a tradition as we move forward and out of this phase. So even looking at those little tiny things that you can take away from it as a positive, I think are very helpful. So don't forget to take care of yourself. I hope I've answered some of the questions that you might have about medical care for kids specifically with developmental disabilities with coronavirus, and I am happy to take some questions if anyone has any.
Thank you, Dr. Reed. That was wonderful. Let me see what we have here from some folks.
Sure.
So I know back when you were talking about the medical aspect of having some of the emergency numbers handy and things like that, people were asking too about insurance information and all of that good stuff. And I think that that is probably definitely something we would recommend for people to have handy with
For sure. I think, if your child comes in extremis, they're going to treat them without the insurance information, but eventually they'll come around to getting it. And so if you have it in that packet, it definitely would be helpful.
Exactly. And if they're a guardian, it doesn't hurt to have all of that paperwork together.
Guardianship paperwork for sure. Yeah.
Exactly.
The issue about visitation holds for young adults and adults with developmental disabilities as well, meaning that anyone with, even in the adult hospitals, an individual with a developmental disability will be allowed a companion, a single designated companion from their family with them.
Mm-hmm.
I hope the guardian most likely, but. Mm-hmm.
It looks like when we were talking about some of the comorbidities, or even just the type of disability there in the very beginning, one person asked about folks who have mast cell activation syndrome. Do you know anything about that particular?
So mast cell activation syndrome is it very commonly leads to some autoimmune problems and autoimmune regulation problems, and would be considered a potential risk factor for contracting the illness. I have not seen any specifics on whether that, in general, whether mast cell activation syndrome causes worse outcomes for coronavirus or not. I have seen that individuals with autoimmune disease in general do have certain types of autoimmune disease, and that's one that can lead to some difficulty with clearing infections. So that would be a person that I would try to keep more isolated than a person without an autoimmune problem. So really need to be limiting contact very significantly for that individual.
Gotcha. To the person who asked about the agencies and the bad turnover, and you can't get someone from the agency, maybe you could give us a call there at the office, and maybe we could help navigate some of that with you. So I'll reach out to you after the webinar, and we understand, yes, with many of the boards of DDs and the providers, that the services sometimes aren't there. So I think we're going to have to work collectively together on some of those things. So I'll reach out to you afterwards, and maybe there's something we can do to help with that situation. So another question is, what if you live on your own and your caregiver gets sick, or you can get sick and now the caregiver can't come? I think that too. I know for myself, so I'm mom to twin boys. Mine are 18 and I have one with autism. And so I had a discussion with my SSA at the County Board of DD, if you're served by a board, and that actually went into the plan. They wanted to know what my plan would be because my husband's traveling. And so if I get sick, it pretty much means that there's nobody left to take care of anybody. So what would my plan be? And that would be, I would be in a crisis situation and I would need someone to call and help, hire someone to help. So Dr. Reed, do you have any other suggestions in that area?
Yeah, I think reaching out to the DD board is a good first step. If you have an SSA or somebody that's your main case coordinator or contact there, I would ask them that question. I know that there are, in that situation, so if you were ill and your caregiver was ill, I think that you would be eligible for emergency nursing to come into the home, and that would be coordinated by the health department and the DD board.
Gotcha. Hopefully that's a good.
Good question.
What precautions should we expect adult day and schools to take when they reopen?
That is the million-dollar question, and I don't know. I think that I think that it's going to be a graded process with limited numbers of individuals allowed in one building area at one time. I don't know what that's going to look like based on public health recommendations. My guess is that it might be a situation where based on square footage, there would be a certain number of people allowed within that context. I think there's going to be the potential. I would love it if we had some antibody tests to allow people back into that environment. I don't know if that's going to be forthcoming fast enough. I think that there will definitely be some tracing of COVID contacts that we can do more aggressively, and that the public health department plans to do more aggressively now that cases are starting to decline, and that people with secondary contacts won't be allowed into a school or an adult care facility. And I think it's likely that there might be some creative social distancing, like having half of the clients one day, half of another, to create more spacing and less interaction at first. I wish I had that answer. Yeah.
We all do. We all would like to know how we reopen.
Yeah.
A last question that I see here is, this person has legal custody and the grandkids live with them. The parents who live at group homes want to visit. So how would you handle that? I
see. So the parents are in a group home environment and they'd like to visit the children who are in custody of the grandparent. That's tough, and I think it probably, I don't know that there's a legal answer on that. I think that it probably depends on a family situation. I would say that the adults who are living in group homes are at slightly greater risk for having been exposed to or contracting COVID because of the closer living quarters and the difficulty with providing adequate social distancing in group home environments. But every group home is different. It depends on how many people are there, how many care providers that they have. If the decision was made, I certainly would plan carefully about where that were to occur. I wonder if that might be a possibility to have some visits outside, like in the lawn of the group home, so that there could be some social distancing and limited contact with other individuals that were there. So just with the parent alone. And I think that a conversation has to happen between the grandparents who are the custodial guardians of the children and the parents who are interested in visiting, which I totally get, uh, about grandparent safety as well, because the grandparents are the caregivers, and if they are in a much higher risk group. So you're talking about their medical status might play a role in that final decision for the family.
Gotcha. All right, well, I think that's all we have at this moment. Everyone, this has been recorded, and so a link will be sent out to the recording so that you can reference it, and please share it with anyone that you think might benefit from the information. Dr. Reed, thank you very, very much. I think you've definitely touched on a lot of things that I've heard from parents. The anxiety level has been, a wide spectrum all by itself, and so you've given us some good information to keep ourselves healthy and safe, and plan in case something were to happen. I know none of us want it to, but it does really help us if we do have some sort of plan put together ahead of.
That's right. Just having that control as much as you can helps. Yeah.
Exactly. All right. Well, we wish you guys a very restful evening, and we hope that you've enjoyed the presentation, and that you'll continue to be safe and healthy. So thank you, Dr. Reed.
Bye. Absolutely. Bye. Take care. Bye all.